October 7th, it's the Public Health and Safety Committee. We have Evans, Gamble, Nash, Rosenberg, Swope, and Taylor, so we do have a quorum. We're going to go ahead and start with the first resolution, RS 2021-1263 by Gamble, Johnston, Allen, Bradford, and Stiles, appropriates $9,069,614 in American Rescue Plan Act funds from Fund Number 30216 to General Services to expand the vehicle fleet of the Metro Nashville Police Department, the Nashville Department of Transportation, and the Davidson County Sheriff's Office. Do I have a motion?
So moved.
It's been moved and properly seconded. I'd like to recognize Councilwoman Gamble.
Thank you, Chair. I just want to say, as a representative of the ARP committee, that when the different departments came to address us, it was not the first time. They had come to address us about the need for fleet early in the pandemic when we had the first round of funding, the CARES funding. But at that time, we had limited funds, and the focus was on our emergency response and the community needs. So we did not recommend any funding towards the fleet. So with this second round of funding, the ARP funding, the committee felt that this was a good opportunity to address this need that we've had for a long time, and to address it without putting all of the responsibility on the backs of our local taxpayers, using this funding or using this opportunity to address this need. However, I do support a one-meeting deferral, which was made in the Budget Committee last night and in our Transportation Committee just a few minutes ago, to get more information about the type of vehicles that are being requested, and also just make some other clarifications about the use of the vehicles for different shifts. It was explained to us during the ARP committee that the need for the vehicles, particularly from the MMPD, was because there are currently not enough vehicles for the officers that we have. Officers are using vehicles 7 days a week, 24 hours a day, because we don't have enough for different shifts, so they are using them for all shifts. Detectives are driving their personal vehicles because we don't have enough vehicles, and the vehicles are old and run down. I experienced myself firsthand after leaving a community meeting. A community engagement officer tried to leave, and his vehicle would not start and had to be jumped. So that was the poster for we need new vehicles. So while I support this resolution, I do support the one-meeting deferral for more information.
I'll second the motion for a one-meeting deferral and call the vote.
All right. All in favor of a one-meeting deferral?
Yep.
Aye.
Anyone opposed? All right, we're deferred for one meeting. Okay. I'm going to take RS 2021-1265, RS 2021-1017, and 2021-1018 on consent. Does anybody have any opposition to that? All right. Go ahead and get started. RS 2021-1265 by Allen, Evans, and Stiles approves Amendment 1 to an intergovernmental agreement between the Tennessee Department of Health and the Metro Board of Health to provide child fatality review services in the sudden death of young SDY and children under age 19 investigated by the Medical Examiner's Office. BL 2021-1017 by Evans and Allen approves an agreement between Trevecca Nazarene University and the Metro Nashville Police Department, or MNPD, to partner with the Criminal Justice Studies Department of Trevecca Nazarene University to provide career opportunities to qualified students. BL 2021-1018 by Allen, Evans, Gamble, and Porterfield approves an agreement between Lights On and the Metro Nashville Police Department, or MNPD, for the participation in the Lights On program that provides bulk repair vouchers that officers may distribute to a targeted area in lieu of traffic tickets. Do I have a motion? Do I have a second?
Second.
Very good. All those in favor?
Aye.
Anyone opposed? All right. Thank you very much. And just in time for BL 2021-973, Stiles and Porterfield, amends Title 8 of the Metro Code of Laws related to animals.
So moved.
Second.
All right, it's been moved and properly seconded. I'd like to recognize Councilwoman Stiles.
Thank you very much, Chair. Very quickly, I actually am going to withdraw this bill. When we came back to the table, it looks like the Health Department wanted to add in some additional parameters. So doing an amendment would have made it too confusing. So we'll come back for the first meeting in January for a week. Yeah, it's I guess we'll be here for the second.
Okay, very good.
Thank you.
I second the motion to withdraw the bill.
Second the motion. All those in favor of withdrawing this bill? Anyone opposed?
Do they need a vote?
I don't know.
No.
No? All right, well, we've
We have
approved
one
it
now.
anyway. Since we were so rapid, I do want to give, Mr. Sharp, if you have any updates that you would like to make to the group. I don't know if there's anything you want to share that's relevant.
I'm sorry?
If you have any updates or anything that you feel like you need to share with the group while you're here.
No, I think everything passed, I'm good.
I meant general health concerns. Is there anything relevant that you'd like to share? Okay, Councilwoman Pearson.
Okay, so Omicron,
I'm sorry, what?
can I direct the question?
Absolutely.
Do we have any, updates on any, Omicron, any updates that we need to know about the Delta variant?
The variants.
It's around. So far, the evidence suggests that it is both much more contagious and possibly less severe.
You said more contagious but less severe?
That seems to be, I mean, they're still trying to figure it out, but that seems to be the way it's trending, which is the way most coronaviruses eventually do. The variant that eventually takes precedence is the most transmissible one and usually the least severe. That way it stays alive and doesn't kill the host.
It's a bad flu, take some NyQuil.
It becomes a cold. Most coronaviruses are in effect a cold.
All right. Any
Thank
other
you.
questions for Mr. Sharp?
No.
Okay. All right, well, with that, we will adjourn. Thank you.
Nicely done. Thank you.